And thank you for joining us today for the COVID-19 Omicron variant. And then, is it really a cause for concern of what we're seeing? And what will your next steps be there for the workforce to protect the environment there? For those of you who I may not have met yet, my name is Holly Foxworth. I'm one of the registered nurses here at Axiom. I'm also the marketing manager for content, and I have an amazing CMO duo that is joining us today. We have the infamous Dr. Scott Cherry, that's the Chief Medical Officer, followed by Dara Wheeler, who is our Chief Marketing Officer. So we had the two CMOs all at the same time, same letters, different functions. So before I have them go ahead and introduce themselves, I did want to point out just several things that we're looking at maybe here on the platform. The first being that if you look on the right-hand side of your screen, at the bottom, that is where we call the resource section. So there's multiple resources that are there. We have white papers, there's some additional employee health guides, in addition to risk calculators, and I think we even tossed in the slides from today. So if you're interested or you have a need for any of that information, please help yourself. You're more than welcome to take a look at anything that's there, and that would be of assistance to you. And then right above that is actually your admission ticket then for the new webinar series that we are starting tomorrow. I know today was a special ad with everything that's going on. We normally do those on Thursdays, but starting tomorrow, that'll be whenever we kick that series off. The title of that is New Days, New Ways to Effectively Manage Employee Health in 2022. So without getting too far in the weeds, I will just mention that I think that we all see the writing on the wall. There's a lot of things that have changed this year. We've seen a lot of blurring of the lines between the personal health and the employee health. And so what we're going to see this year is really kind of a migration in that area of looking for new ways to get some of these functionalities appropriately addressed, and so that you can also take care of your employees there. So the first guest that we're actually going to have tomorrow is Dr. Christine Dickerson, and she is with Green Imaging, and so they will be talking to us about some additional opportunities, some alternative pathways that most probably weren't even aware exist when it comes to employee diagnostics and imaging. So I'm really excited to have them on. I think Dara is actually going to host for us tomorrow. And if you haven't done so already, you can go ahead and just click right there on the Register Now button. Again, that's at the top-hand right of your screen, and that'll get you signed up without having to enter any additional information. All right, and the last thing I wanted to mention here is on the left-hand side of your screen, you'll see there is a purple box that should be there. We've always been very adamant that these opportunities for us to meet with you are solely that of thought leadership and education, but we do hear, we're getting the feedback that there's a lot of anxiety, there's a lot of stress and somewhat panic of how it is that employers are going to be able to implement some of the new OSHA ETS mandates. So if you have questions about that, if you need some additional help, you're more than welcome to select that button as well, and we can get you in touch with some of our team members that can kind of give you some ideas and guide you along what that may look like. So I'm going to go ahead and let our panel introduce themselves, and then we'll get started into the content for today. Dr. Cherry, you want to go first?
Sure. Thanks, Holly. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. My professional background is I'm board certified in preventive medicine and public health. I was a medical officer in the U.S. Army for 10 years, and I practiced primary care medicine and then specialized in preventive medicine and public health for the last part of my Army career. And then I've been supporting corporate, military, and industrial operations since then, and so it's a pleasure to be with you today.
I love it. Thank you so much. We're excited to have you. Dara, you want to go next?
Thank you, Holly. My name is Dara Wheeler. I'm Axiom's other CMO. I'm our Chief Marketing Officer. I've been with Axiom for 15 years and loved every minute of that 15 years and talking about occupational health and medicine and in the workplace and keeping people safe. Thank you.
Love it. All right, good deal. Well, just to kind of give you an idea of what it is that we're going to kind of go through today, where we'll put the majority of the focus. So we'll go through, speak about the new variant. What does that mean for us? Is it really dangerous? Is it really cause for concern? We will take then also the focus of the severity that may be associated with that, looking at transmissibility, and then also how it is that our vaccines may stack up against this. Will we be protected? Will we need to look in other directions for some updates there, et cetera? And then finally, we'll finish that out with discussion of the OSHA ETS and what implications there could be there, and then also what steps you need to take to protect your workforce there. So Dr. Cherry, I'll let you kind of jump in here first. And it looks like we had some new information today in terms of our first case in the U.S. Is that correct?
Yes, I think they've detected someone in California with a case today. Was it? Things are moving really quickly, and so I think probably around the 11th of November was when they've really, out of South Africa, scientists were able to sequence a significantly different variant from the Delta coronavirus. And I do think there's ongoing community transmission in a lot of the South African countries. And we do now see evidence of cases kind of, throughout the world. Again, starting out in South Africa, then detected in Israel, Hong Kong, Belgium. And now I think we're seeing it in Europe more broadly. Potentially already here in the U.S. And so I think this is something that the World Health Organization has deemed a variant of concern. There's a couple of different levels. There's a variant of interest and then a variant of concern. And so, concern is kind of a broad, non-specific topic here, but I do think from a global perspective, because right now Delta is the dominant variant with high levels of transmissibility and fairly high levels of severity. When you see another variant able to take foothold in different regions, it does speak to its ability to maybe outcompete the current strain, Delta. And so Delta is quite transmissible. It outcompeted the Alpha variant and then the wild strain originally. And so we do think that, granted, we will learn a lot about this virus in the next week to month. But I think just from a kind of intuition, many experts are thinking that there is a good chance that Omicron is going to be more transmissible and could overtake Delta. I think a lot of people tuning in, when they hear variants, it's very concerning. But I'll probably just spend a little bit of time in the sense of, I think even some of our public health officials now are starting to shift their goals for coronavirus from elimination to managing it long-term as an endemic type of disease similar to flu and maybe even common cold coronaviruses. And so what happens, especially in RNA viruses, so with genetic material for organisms, you have either a DNA, which is a much more robust process of genetic coding, and when there's reproduction, there's a lot of error proofing. When we, like for instance, humans reproduce from when our biological cells reproduce, there's potentially errors in those reproductions, but there's some proofreading and actually error fixing type of processes that happen. But with RNA viruses, they're very prone to a lot of errors when a virus reproduces. And so because there's not that error proofing mechanism, you do see a lot of mutations as a virus proliferates within organisms. Most of the mutations actually are not viable. They're just kind of random mistakes, and they make the virus less resilient. But I think it's estimated that when someone's infected, they may have from 1 billion to 1 trillion reproductive cycles in their body, which is absolutely huge numbers. And so occasionally there's going to be kind of this a lottery effect where these random mutations actually confer advantageous characteristics. And so right now from the sequencing, it looks like there's probably 50 mutations in the Omicron variant compared to the original type. And so, that's a fair amount of mutations. With the Delta variant, there was probably 30 or so. And so what it means to us from a symptoms perspective, and again, this is very early on with just small numbers of data, the symptoms do seem to be significantly different. And we will get better confidence in this kind of information as time passes. But what's very interesting is that it appears the hallmark loss of taste and smell is not really a prominent symptom with this variant. And also coughing is much less often seen. So I do think it's going to make, from a symptoms perspective, with medical surveillance, more challenging in many ways. And then I think the way it affects testing is to be seen, but early indications are that testing, whether it be PCR or antigen testing, would still be relatively effective. And this isn't really a binary kind of outcome. I think a lot of our audience realizes that testing is kind of a continuum of effectiveness. So there's no 100% sensitive or specific test, but we've seen with variants that those sensitivities potentially drop off. And I think that may be the case with testing as well, depending on which specific protein or genetic sequence they're looking for in the testing.
Yeah, great information. I was going to ask you about that because, the plan initially for us to be able to kind of make our way through here was going to be the use of additional testing and having that supply increase significantly. So there was initial discussion, it seemed like earlier this week, that maybe the antigen testing that could be readily accessible, that wouldn't be as effective. Is that false at this point?
I wouldn't say it's false. I think we'll get better understanding through lab and epidemiologic studies that can kind of help us understand the decrement in the current testing technologies and its ability to detect, real infection.
Yeah. Okay. Good deal.
And Holly, before we jump,
sorry,
before you jump in, I was going to say that I've already seen a bunch of questions start to come in, and I know a lot of you out there have questions about this variant and how to handle it. So please submit those questions, and we'll address those with Dr. Cherry at the end. But I just wanted to jump in and say that before you moved on. Go ahead.
No, you're exactly right. And I was going to ask you, I know that you have a lot of communication with some of the clients that we have. Does it feel like that they have some of these same questions about the testing and kind of this panic state of what it is that we do now?
Yeah, there's a lot of questions about testing. There's a lot of questions about vaccination, what it means for both, and also how do we test for the variants. And I think we'll get to that in a little bit. There's a lot of questions that people have about how labs actually differentiate. I also saw a quick news item today. We're local in Houston, and the Houston Water Department is testing the wastewater right now to see if there's any of Omicron locally in Houston. So I think there's a lot of different ways locations are testing and trying to see if the variant is here locally and what to do about that. And so there's a lot of kind of quickly moving research and scientists trying to figure out exactly how to deal with this. But we'll go into the question about how they differentiate the variants in a little bit.
Yeah, definitely. Okay, perfect. Yeah, Dr. Cherry, do you want to talk to us then about some of these individual areas that are being so closely watched to give us some answers and insight into what we need to do and how we can manage it?
Sure. And I did kind of touch upon transmissibility. So how easily does someone infect another? And so the reproductive number, or R naught, is kind of used for that. I heard an estimate of it being 2 right now. So for every person that's infected, they're going to infect 2 others. I think that's going to be relatively dynamic, depending on a host of things. But I think just that number needs to have a higher confidence over time. But just based on its ability to outcompete Delta, the Delta variant in those areas is a strong indicator that it's going to be as or more, maybe even more transmissible than Delta. And Delta was a relatively very highly transmissible virus. I think what's, maybe even, equally or more important is severity. So does this variant cause more severe disease, more hospitalizations, more deaths? Because there's obviously a continuum of disease that coronavirus can cause, from asymptomatic, mild to, needing hospitalization and or worse. And so I think that's to be determined. I think the physicians in South Africa that have kind of the best, earliest experience are actually saying that they feel like the severity of this variant is milder than what they've seen with Delta, and potentially younger persons as well. And so that's relatively promising to hear. And when you listen to virologists talk about just viruses in general, and as they continue to mutate and create variants, the common trend is that variants do become more transmissible but less severe. And, obviously viruses are obligated to find a host to live and reproduce in. And so if a virus becomes too virulent, or the ability to cause too severe disease too soon, it kills the host off before they can reproduce successfully. So that's kind of anecdotal, kind of in general, but we'll see if that continues to be kind of the trend for this variant. And I think another huge question to focus on is, will this variant evade current vaccines? And so, the current vaccines are focusing on the spike protein of coronavirus. And so we did see some vaccine efficacy drop from the wild and alpha type variant to Delta variant, but still had really good levels of protection. But it did lead to kind of the recommendation of a booster. And so there probably will be further sliding of this vaccine effectiveness with regard to this variant, but it's does it drop vaccine effectiveness from 90% to 80% or to 20%? And that's to be determined. And there's a host of individual factors that can cause vaccine effectiveness to wane over time as well. So I think we'll learn more about this over the next week or two. I'm sure there's plans to do laboratory in vitro studies that look at how well do the antibodies from vaccinated neutralize the virus in testing. And then we'll also see a lot of epidemiological studies that will address severity and transmissibility as well. And so I think the timeline for answers will be on the course of days to weeks, maybe up to a month or so, and we'll continue to learn more and more. And so again, just in general, we know the many protective factors that can help us globally across all infectious diseases, and especially coronaviruses. So it's especially important to see if those kind of foundational protective measures are still working. Do we need to maintain 6 feet, or does it need to be further, a longer distance? Do surgical masks and N95, are they less effective compared to Delta and the previous strains?
Good information, yeah. And I think that Derek brought this up initially a while ago. We kind of touched on it a bit, but there are a lot of questions as to how it is that you would test for this and understand whether you are infected with this variant. Could you kind of give it, I know that's a lot of detail there, but could you give us maybe an overview of how it is that they're able to detect whether this is the illness that someone is experiencing is associated directly with the variant?
Sure. And when most people are getting tested, it's usually not a sequence test. It's really a qualitative test to determine if they literally test positive or negative. And there's lots of pros and cons to the PCR test and antigen testing, but I'm pretty sure they're going to run studies that will have sequencing, which will detect this new variant very sensitively, and then also run parallel tests with the current existing technologies of PCR and Anagen, and we will get a good sense of the relative effectiveness of those tests. But in general, the large regional labs will do sequencing testing on batches of tests just to see if there's a change in the virus makeup. But for now, I think we're going to need some preliminary understanding of, does their current technology, how well does it match up to sequencing, which would be the gold standard at this point.
Okay, all right. And I think I saw, let's see, it looked like there was someone that questioned that as well. Let's see, I think maybe it was Christy that was asking, she was asking, how do they test for the different variants, and are there different tests? So just to confirm then the answer to her question then would be that they would perform the sequence testing, that would be how the variant is determined, correct?
Correct. And so essentially, just to give you a little bit of insight, sequencing is actually looking at the amino acid sequences of the virus, whereas the antigen is looking for a specific protein, and then the PCR is actually looking for the genetic coding. And so once there's certainty about if our current technologies can detect to a certain threshold effectively, then we'll know if we need to change those technologies to match up to the new variant, or if there's enough if there's enough of the previous coronavirus there that will be easily detected.
Okay, and there are a few labs, Holly, that we work with that do variant sequencing. I know there's a few in the U.S. that do that. So most of the time when we receive a result for PCR testing, it doesn't tell us specifically what variant is the result. It doesn't say this person was positive for coronavirus and it was Delta. It doesn't give us that additional level of detail on most tests. There are some labs that will do that, but you have to specifically request variant sequencing and make sure that they're testing the sample that way. But there are labs that we work with that do that, and often for very low prices. So what we're seeing is more and more clients interested in understanding, as this is changing, what variants are in their populations more readily.
Mm-hmm.
Yeah, and I think it'll be interesting to see if there's going to be two variants that are existing in parallel, and that may indicate a change in how we look for testing to test for both variants. Or, historically for coronavirus, once a new variant has taken hold, it's been the dominant strain. And so there was not a lot of value in sequencing every individual person. And that's why it's actually done at the regional level.
Gotcha. Okay. And then before we jump over to the workplace protection, I did want to also get your thoughts on it. It looks like there's a lot of discussion then about travel, maybe putting some limitations there on where people need to be and what that would look like at the airport. It looked like they were doing some additional screening there at least I think it was like four of the U.S. airports. Do you have any additional information on that, or want to maybe kind of just summarize what some of those initiatives are to minimize the spread?
Yeah, I mean, I think my general thoughts on kind of international travel would be to really prevent doing it if at all possible. I do think the rate of international travel does quickly accelerate how fast a new variant or even just the infection in general can travel. I think one of the as this was all kind of unraveling, I think I heard a report of a large plane, leaving South Africa headed to Europe. Once they landed, they tested, everyone, and there was a 10% infection rate of those that were on the flight. And the rule at that point was unvaccinated needed to have a negative test, and then vaccinated didn't need a test. And so you had a good proportion of people that were relatively screened or at least had been vaccinated that had been infected, and then a small proportion of those are actually with the new variant. And so, I think this is already, in the sense, the cat's out of the bag. I think the travel controls will maybe now limit the spread, but I do think that the variant has probably traveled a good amount already. And I'm not an expert in the travel rules, but I know that citizens are usually allowed to return to their home country without any delay. So there's not a perfect control there in place from my perspective.
Then moving on, then, as we kind of wrap some of this up, I wanted to spend some time then on just kind of focusing on what it is that we need to do. How is it that we need to be looking at our workplaces and making sure that there's appropriate measures. Dara, do you want to start out here kind of talking us through that layered approach, and then we can kind of sprinkle in some of the additional discussion of OSHA as well?
Yeah, I think the news cycle is moving so quickly right now that the next thing that comes up we keep kind of focusing on and really concerned about. But the things that have kept us safe from the beginning, for the last 18 months, 2 years, have been these layers. And while we'll figure out, and the scientists are rushing to figure out testing and vaccination and immunity and how we handle this, it continues to be critically important that we stack up all these layers. And the physicians we work with, like Dr. Cherry and other physicians in occupational health and population health, very much focus on the layers and making sure that you've built this protocol and built these programs in a way that protect employees in the workplace. And I do think they still work very, very well. And so if you continue to think about, like Scott said, even things like 6 feet versus closer distances, how we handle that, it'll be very critical as we think through the progression of coronavirus and other infectious illness in the workplace, which I think is something that gets a little bit overshadowed right now. And one of the anecdotal things that we've heard a lot from organizazations is that as they've returned back to the office, they're seeing a huge spike in influenza, colds, strep, hand, foot, mouth, pink eye. I mean, all sorts of these different infectious diseases that sort of disappeared last year when everybody was at home or distancing. So all of the other components besides testing and vaccination, like isolation and health attestations, PPE, those will not just prevent coronavirus, those will prevent any infectious illness in the workplace, or at least reduce your risk as much as you can. Scott, I don't know if you have any additional pieces around that.
I think just continuing supporting what you've said and what we do here at Axiom. I think I think a lot of times people look at medicine and want kind of the very exciting cutting edge technology, which I think we do have from vaccination and testing in many ways, but it's kind of the, I want to say old fashioned, but maybe traditional approaches to safety and risk mitigation applying to infection control, whether it being kind of policies and procedures at the workplace, adhering to your personal protective equipment, zero tolerance of illness in the workplace, regardless of the cause of that infection, are huge components to it. but also in your personal life. I know, many people now that have had plans for traveling for the holidays and maybe just for vacation internationally are putting them on hold. And, I think it's a personal decision unless the government steps in with, halts in travel. But trying to live your life in a way, whether it be in the workplace or in your personal life, that really kind of helps manage the risk best for you based on your values and your personality type, things like that.
Yeah, great information. And I also wanted you to maybe comment on the discussion CDC had put out this week about the importance of continuing to get these vaccines, and then also speaking to the booster and availability and who should go ahead and get those. Could you mention that as well?
Yes, and that what a lot of studies have shown is that the vaccines are very effective at preventing severe disease and death, and that there is a waning of immunity over time. And so there is a recommendation, initially it was for high risk or vulnerable populations for severe disease, but now there is a recommendation for all to get a booster at the appropriate time interval. And so there's some nuance between them, but usually it's, I think with Johnson & Johnson, it's a couple of months after your first dose. And then after one of the messenger RNAs, it's at 6 months. And so, that's broad general recommendation. I always advise people to talk to their personal physician for tailored advice, because there's also now the ability to mix and match vaccines. And so each vaccine has pros and cons that may be applied differently depending on your personal or individual situation. So I think broadly we hear the CDC recommending this, and I think it's good to take that general recommendation and get that tailored advice.
Yeah, for sure. All right. Well, let's wrap it up here. We'll take on the piece of the OSHA ETS mandate before we hop into the questions. Do you feel like that we could see any changes? It feels like there's been a lot that's been going on with this subject, and where the line is. Will it be enforced? Will we see a delay there? And then now, will this change any of the prior language that was included in the initial proposal? Thoughts on that?
Dara and I are always, we met with Chuck yesterday, actually, our chief legal officer, and, he's kind of diving in deep to the stay by the Fifth Circuit Court of Appeals. And I think we're supposed to hear something back by maybe no sooner than the 10th is what he said. But he did bring this up this morning, and it, this probably will change how the ETS is viewed through the court, because it again, I'm not a lawyer, but I know what Chuck has said. There's this grave or imminent danger kind of concern. That's the primary mechanism for which the ETS has been proposed. And so now we have a new or a newer threat with this variant with kind of an unknown potential impact. And so, obviously it's a judicial and political kind of implication from this policy, but me as a medical expert, it does seem to where it should affect it to a degree, but I realize I'm not an expert in that. So Dara, do you have any thoughts along those lines?
No, other than I know there's a lot of questions from clients right now about what they should do and whether they should act and what things to put in place now. And just like individuals, of course, every company is different, and everybody's got their own internal lawyers and counsel and are working through various programs and policies and practices. One thing, like Scott said, they did come out yesterday with a date for when the next round of information is going to come out, likely around the 10th. And at this point, everything we're hearing is that the dates won't be pushed. So if this passes and it is going through, that the testing protocol will need to be in place by the 4th. And in December, the vaccine protocol will need to be in place. So there's a lot of work to do. And I just urge employers to think about how to be prepared and get ready. And like Scott said, this variant may change people's minds a little bit, or change the judges' minds and how to address it.
One thing I might share as well is, obviously me being an OCMED doc, OSHA standards is something that we, follow. And, I've worked when I was an internal medical director for some large companies. Sometimes, many times the company would go beyond the OSHA standard. The OSHA standard is almost kind of the bare minimum because there is a compromise in that process. And so a lot of times other guidances from the American College of Industrial Hygienists or just the own company's internal data about a lot of times, companies may actually have a lot of expertise and data about their employees' exposures that rival or even surpass governmental agencies. And so a lot of times we would have medical surveillance programs that went well beyond what the OSHA medical surveillance requirements were. And so for COVID, I think many employers have never dealt with OSHA, especially with what I would call a relatively sophisticated medical surveillance protocol. But, I know our CEO is really leading the way about best practices with regard to protecting employees. And so, even depending on how the ETS is ultimately decided upon, I do think in many instances, employees will be looking at their employers and trying to see if they're being taken care of. And so in many ways, I think every employer should be coming up with what they feel is most appropriate to protect their workforce, kind of regardless of what the OSHA ETS stands for, provides for, based on their values and how they're trying to protect the workforce. So obviously this is a paradigm shift in many ways, but it's just hard to know what's going to happen from a requirement perspective. But there's another way to look at it as well. But I know there's also a business case as well. So but I just wanted to share those sentiments that people or companies at times do go above and beyond what the OSHA standards are for different exposures.
Yeah, I agree completely. Well, we have quite a few questions that came in. Let's see, we had some that were here and also in the audience panel as well. So it looks like the first one was from Darla, was asking about can they continue to use the Anagen test? And I think that you may have already addressed that one, unless there's something else you wanted to add. Sherry?
No, I mean, I think it's going to be still useful, and we'll just we need to have kind of a quantitative assessment to know how effective it still is.
Fantastic. Okay. And the next one was from Stephanie, was asking about if you don't have the taste and smell there any longer, how is it they would know whether an employee was diagnosed with COVID, if it was COVID, and should they be testing all of their employees that would have any type of respiratory symptoms?
Well, in COVID, regardless of the variant, has been very challenging to weight symptoms to predict COVID versus another type of upper respiratory infection. Yet testing is is the most effective and efficient way for employers to determine when someone can return from work, because a lot of the infectious diseases do not require such a long time out of work. COVID has one of the longest kind of infectious periods. So, if you can test someone for flu or strep or another, RSV, they'll have a much shorter duration of being out of work. And then you just don't want people that are sick in your workplace regardless of that cause.
Yeah, definitely. And Dara, I was going to ask you about this, and we haven't talked actually about this. You and I had spoken about it this morning in our meeting. But there are tests that are available where it could screen for a variety of ailments besides just the COVID from the one swab. Correct?
Yeah, a lot of labs have started to come out with multiple test options, and one of those is the ability to test. Usually, it's influenza, RSV, COVID, sometimes strep as well, but usually it's the respiratory diseases within a single PCR test, and a lab result can tell you and rule out the various tests. And like Scott said, it's specifically important for employers to know the difference, even if it's just syndromic screening or if it's through this test process, so that you can return somebody back to work potentially faster than you would if they had coronavirus.
Good points. All right, let's see. The next one we have was asking about the FDA had voted to recommend the antiviral medications, and when would this be made available to the public?
Yeah, I think an optimistic kind of aspect of COVID management is some of the therapeutics that really affect morbidity and mortality. And there's a couple of them out, but the Merck antiviral medication did get recommended for EUA. And so I would suspect that that would be pretty quickly rolled out to the country for use. I know it's been within the last few days, but I would expect it to be rolled out as soon as possible. So that's really a great, it's another tool for those at the hospital taking care of patients to dramatically affect the severity of disease.
Sure, yeah. All right, let's see. The next one we had was from Rachel, was asking about what should we expect to see? When would we see the uptick in potential positive cases that would be related to some of the holiday travel that we just saw, maybe for Thanksgiving, and then obviously, Christmas following behind that?
Yeah, I think even if the new variant wasn't here, we were starting to see already an uptick of cases because of seasonality, people moving indoors because of cold temperatures, travel. And so, I do think with this new variant too, it's going to just add to that because, most likely there's going to be, some more breakthrough of infections in those that are vaccinated and those that are naturally immune. It remains to be seen kind of the magnitude of that. But I think the country in some ways was kind of bracing for that to a degree anyway.
Yeah, definitely. And we've seen an uptick in ours, correct? The number of cases that have been coming through that are being reported here. Yeah. All right. Let's see. Scott had a really good question. Let's see. Scott was asking, has there been any studies or preliminary indications on the effectiveness of natural immunity, and specifically from having the Delta variant versus the current variant that we're speaking about today?
There have been a number of studies that show that natural immunity is quite good from previous infection for the Delta variant. I think this has been reproduced in many studies. Some studies show actually no reinfections, and then some show some reinfections. But there really is a high level of immunity from natural infection from the studies that I've read. I haven't seen a compelling study that says the opposite per se. So I do think that is the case. I don't think there's anything right now for Omicron. So that will be to determined,
Okay. See, we also have, let's see, Scott was asking, so if existing COVID testing technologies are not as effective at detecting infection of the virus, and it seems that symptoms are less specific to this variant, what would other mitigation measures be that could increase the offset or lessen the ability to identify a reservoir in the workplace? I think there was a lot to unpack there with that question. Maybe we break that apart in several pieces. So I think the first part that he was asking about was existing technology and is it effective at some of this detection, which, I think you've answered that piece.
Mm-hmm.
The other was specific to the symptoms. Would they be less significant?
Yeah, I mean, the early reports are that it's causing less severe disease. So by default, that means, symptoms are milder. And I've always been fairly challenged to come up with a way to weight symptoms appropriately, probably besides loss of taste and smell, because that's very specific. But I think it's really embracing kind of this multifaceted, multi-layered approach where, again, zero tolerance of illness in the workplace or at home. If someone in your house is also sick, try to, help them quarantine into their room, try to bring them food, but, socially distance. Wearing an N95 is much more protective than wearing a surgical mask. And so those are all kind of tools, changing your behavior until we know more about this variant will actually be helpful, just to make sure that it's not creating more severe disease or there's significant vaccine breakthrough or significant natural immunity breakthrough and severe disease, Yeah.
Let's see. Karen was asking, what about people who have recovered from COVID-19? What is their immunity, and is this even being considered as your natural immunities are stronger?
Let me take the last part of that question.
Okay.
I don't think the U.S. has utilized natural immunity in any of its policies yet per se. And can you repeat the first part? It dropped out of my mind.
Yeah. So she was asking about what about the people that have recovered from COVID-19? So how would that affect their immunity moving forward?
Okay. And I actually take that back to one of the CDC guidelines is if someone was infected, that they don't get tested for 90 days, and it's most likely an alternate diagnosis if they become sick again. But I think what is unknown is how long does natural immunity last? Does it wane over time like the vaccine, or is it more robust? As I think through it, if you have an infection, you're exposed to not just the spike protein, which is what the vaccine produces for our immune system to react, but you're also exposed to the viral capsule and many other antigens or many other targets for the immune system to react to. So, my thoughts are that, natural infection does provide robust immunity on average.
Okay. Let's see what else we have. Let's see. Is it possible with various variants that PCR testing might not detect it?
Yeah, I think really what's going to probably occur is the sensitivity levels will probably drop down some from the previous variants. So, the chances of a false negative may occur, but I don't think it's going to be like 0% sensitive. I think it may just knock it down from the 80s or 90% sensitivity to less is probably what's going to happen, because it's even though it's 50 mutations, it's still really a coronavirus in for the majority of its genetic and protein makeup.
Gotcha. Okay. And then Mary was asking, if the vaccinated are infected, why are they not being tested and quarantined to prevent cross-contamination?
Can you repeat that one more time? I started creating my response, but then I lost a piece of it.
No, I will. No, she was saying, is there, if the vaccinated are infected, so if you were
Okay.
vaccinated, but then you were infected again, why then would you not be tested and quarantined to prevent cross-contamination? So I think maybe the reference was maybe to transmitting that to others.
Yeah.
Essentially.
No, yeah. I think as we're seeing case reports, like I think, early on it was unclear or was not expected that you would have breakthrough infections of vaccinated. And so there was early on policies that showed clearly that once you were vaccinated, you had almost no risk of infecting others. And, I think here at Axiom, we were a little bit more conservative than that, just because there wasn't enough robust data for us to kind of clearly indicate that to our clients. So we still remain kind of in a position where people should still be treated not differently than unvaccinated. Now, there are studies that show that there is a chance of vaccine breakthrough with fairly high levels of viral load, similar to the unvaccinated, but it seems to be the duration is shorter. So even if you get vaccine breakthrough infection, there is still a fair amount of benefit. And I think the biggest benefit is the reduction in the risk of severe disease. But I do think that policies, are somewhat of a compromise in many respects. But I would advise that you do not treat vaccinated and unvaccinated differently when you're screening for disease. Just kind of that anecdote that we spoke about earlier, where there was up to about 10% of infections on the flight. So, having testing to screen, especially in close, or if you're doing international travel, is really something I would strongly recommend from the medical perspective. Obviously, policymakers goes through kind of the political and judicial kind of processes as well.
Yeah. And I think that Scott had actually, a different Scott had spoken up about that as well, and was asking if you then are recommending that all international business and personal travel should be postponed as a result of the looming variant, or at least until 2022, when we can see how what the effects may be.
Well, I can advise from the medical perspective. Obviously there's a lot that goes along with, seizing travel that's outside of my expertise with regard to, business, politics, just so many different things. But when I was in the military, we would advise the commanding officer kind of our expertise, but obviously the decision maker is looking at all of the consequences of that. But, I think, at least testing everyone, I think, is really a great way of limiting the spread of that, so to speak, if not halting travel is, can be done effectively. Some of the policies I've seen are that, you need a negative test within like 3 days. So it just depends, right, on the behavior of that person. If that person's like me, that's kind of staying at home all the time, if I get a test 3 days ago, then my risk of getting infected is quite low. But if someone's quite active in the community or traveling a bunch, you may need a test, and we kind of get into nuance of that. An antigen test can give you a result in about 15 minutes. So, you could almost get an antigen test right before you board, whereas a PCR test, although it's more sensitive, it takes maybe up to a day, 8 hours to a day. And so obviously there's a compromise across many points, but I really do think testing is a key way, especially in these times of unknown, so that's kind of where I'm at from a medical perspective.
Yeah, definitely. And then Sandy, I think, was just wanting to confirm what we had spoken about earlier. Just asking, so even if OSHA releasing that they are extending the deadline for comment, are you still thinking that there would be a possibility that it would be implemented prior to the comment deadline?
If I'm understanding the question correctly, Darren and I have directly asked, our chief legal officer this, and his perspective is he does not think the court has the purview to push the dates. The court can only speak to the constitutionalness and maybe the I'll just keep it very broad, the legalness of the executive order or the OSHA ETS. But I think from what he's told us, the court doesn't really have the ability to push the dates. Like, so, hey, because I would suspect, okay, I'm a business owner, I'm waiting to hear back, but, the deadlines are coming. December 4th or 5th is coming, and then January 4th is coming for those different deadlines. But that's my take. Was I misquoting Chuck there?
No, you said it exactly correct.
Okay.
Yeah, from our understanding, those dates are not being pushed. Chuck thinks that there may be a push from the government to implement the testing protocol while the courts are figuring out whether this is legal or not. From what it sounded like he was just kind of crystal balling it a little bit, but he thinks they may push for the testing protocol at a minimum to be implemented as the courts are figuring all of this out. So it's a lot of kind of to be determined, but I expect in the next 9 days we'll know a little more.
Yeah. Okay. And then let's see, it looks like we had some additional ones that were just asking about updates. So Justina, your question about as we get more information, will we have additional webinars on this topic? Absolutely. As we did today, we had our webinar that was already scheduled for the week. That would be tomorrow. But as this came up, we went ahead and created an additional one. So if there's anything that comes up, you bet we will get something scheduled and make sure you're invited. Let's see. Rob was asking about how many, he was saying OSHA recordables that would be related to COVID. I don't know that we could speak necessarily to the recordables as that would be on their individual logs, but Darren, do you have a recent case number of the number of cases that we have managed?
Yeah, and I think that's a really interesting question. And I think from things that both Scott and Chuck have talked about before, it's going to be it's really tough to prove that COVID wasn't contracted in the workplace unless you have good records and you're able to kind of track and contact trace. It's often very hard to prevent was the spread in the workplace or was it contracted somewhere else? But if you look at just the cases Axiom has handled, now whether employers have either submitted that to OSHA or to work comp is another question. But if you look at only the cases Axiom's handled that are either confirmed COVID cases or suspected COVID cases, we've handled, as of today, 193,000 cases since last March. So that's a whole lot of cases. And I don't know how many were reported to OSHA, but I expect a big chunk of those were reported to OSHA.
And OSHA recordability, fortunately, falls under kind of the safety professional bucket. We can provide medical opinions about work-relatedness for a host of things. COVID is obviously a new one, but what I've seen some of the very large companies do is, depending on their risk appetite or how they view it from a legal perspective, they've chosen to record their cases with an asterisk, and then that way, once there's clarification by their own legal department or more broadly from OSHA or other regulatory, then they can go back and actually change the log if there's different levels of threshold that is considered work-related or not. So,
but we do gather a lot of that data for our clients as well.
Yeah.
We do even if it's just anecdotal to start with, and an employer does further investigation, we do ask employees whether they contracted it at work or at home or where they feel like they got it from. But at least we start the documentation process and then let our safety friends take over the investigation.
Reminds me of kind of our, legacy service incident case management, where, our first assessment is essentially the first report of injury. For many clients, they essentially will copy kind of our medical assessment as kind of official evidence of the case with the mechanism of injury and extent of injury, things like that. So anyway, it's the DNA of ICM is in our COVID case management.
Yeah, for sure. Well, Dara and Dr. Sherry, I appreciate you both actually joining us today. I know it was a big ask to throw this together at the last minute, but I thought it was vital that we get some information out to those that were able to join us today. So I appreciate you doing so. Final kind of closing remarks here. I will mention again that if you haven't already, we will start that next series that will be for the new days, new ways for managing employee health. That starts tomorrow. Dara's going to host that while I am out. And if you haven't already, you can just click that register now button. That'll get you signed up. On the left-hand side of the screen, if you have questions, you want to speak about any of the occupational, the OSHA COVID compliance, you're welcome to select that entry there. And then obviously the resources again at the bottom. So thank you for joining us. We appreciate your attentiveness, and we look forward to seeing you tomorrow. Thank you.